And so we talked about that, a $17 million increase to help with the costs of families and their hopefully being able to find and sustain work. And so on the income assistance, the two core programs up by 3%, depending on your circumstance, where you live, whether you get the adult basic benefit, the shelter benefit. It could be a different number for each individual, but the third year in a row we've been able to increase those rates. Mobile outreach services, there's funding for 10 FTEs to increase that good work, where we have caseworkers on site in CBOs throughout the province of Saskatchewan. Expanded trusteeship, money management support, in addition to direct pay, which just deals with basically the shelter benefit, our core income assistance programs. That's one option for people who are having their challenges meeting their obligations financially for the most part. And but trusteeship, I think, is a little bit better. It's more of an education thing, and it looks at the whole of income approach. Individuals may qualify for other areas of support, particularly from the federal government. And so those are some of the things that we've been able to bring forward. I talk about the personal care home benefit. That was an increase to help cover those costs for folks that need help in a private care community. There's some smaller things on said clients with children receiving a higher annual benefit, cover the expenses for school supplies, and a new benefit introduced on the CIS side for identification. That's something that has been brought forward as a barrier or hurdle for individuals receiving income assistance. So we hope, as we always do, work with our community-based organizations to work with clients, obviously, but this may be one little gap that hopefully we're able to help with. Again, something I've heard in my conversations with people in this area. So I would turn it over to officials for the I believe it was 4 or 5 areas that the member had asked information for at the end of yesterday's deliberations. So.
Good evening, everyone. Thank you, Minister. My name is Devin Exner, Assistant Deputy Minister, Income Assistance. The first question was in regards to the number of CIS and SED households and beneficiaries that are currently on the programs. So to your question about households on CIS and SED and the number of beneficiaries, as of February 2024, for CIS, there were 19,083 households and 35,070 beneficiaries. For SED, there were 18,165 households and 22,548 beneficiaries. The next question was around dependency rate. The income assistance dependency rate is a long-standing metric that represents the proportion of the population aged 0 to 64 that are eligible for Saskatchewan health coverage and not residing on a Saskatchewan First Nation, and also receiving Saskatchewan income support or CIS benefits or the Saskatchewan Assured Income for Disability benefits, known as SED. Last year, we provided you with the dependency rates from 1990-91 all the way through to 22-23. We do not have the full year for 23-24 statistics just yet, but from April of 2023 to January of 2024, the dependency rate was 5.6. So with that, I'll turn it over to ADM Eberhardt.
Good evening, Toby Eberhardt, Assistant Deputy Minister for Child and Family Programs. I believe the next question was an update on our Lincoln case management system for the year. So in 2024-25, our budget for Lincoln is $2.846 million. And now I'll hand it back to Devin.
In response to the costs incurred for my case, in 23-24, maintenance costs for my case, including licensing, is projected to be $2.48 million, and the budget for 24-25 for maintenance, including licensing for my case, is $3.508 million. With that, I'll turn it over to Deputy Minister Kratzik.
Thank you. Kimberly Kratzig, Deputy Minister. You had asked a question about the number of people leaving the ministry over the past couple of years. In 2021-22, 100, and this includes retirements, 169 individuals, permanent full-time individuals left the ministry. In 2022-23, 160 individuals left the ministry, and I do not yet have complete data for 23-24. With that, I will turn it back to Mr. Exner to discuss the last two questions that you asked.
This question was around IA cases and closures. So the total number of CIS files closed was 9,681 from April of 2023 to January of 2024, and 2,598 for SED for the same time frame. We do not have information available for 2021 and 22-23 as requested. Cases can be closed for various reasons, such as the person finding employment, becoming eligible for other sources of income, and other changes in their circumstances. The ministry does track why people leave core income assistance programs when clients inform the ministry of that reason. But clients do not always let the ministry know why they no longer require income assistance. And the last question was around applications. I think specifically focused on SED. So as there are different phases of SED eligibility processes, there is not a simple response to how many applications have been received for the program. Ministry staff work very closely with all clients on a case-by-case basis to ensure that clients are accessing the program that best meets their needs. Individuals applying must meet income assistance eligibility requirements. Some examples of this would be applicants must be at least 18 years of age and reside in Saskatchewan. Then there's a series of questions that applicants are asked around their financial eligibility. If an individual meets the basic and financial eligibility requirements, a medical form is completed to confirm they have an enduring disability. So that would be part of the SED application. The medical form must be completed by a medical professional, and they must indicate that the disability is permanent. Once the completed medical confirming the disability is permanent and is received by the ministry, the applicant is referred for an assessment of the impact of their disability using the disability impact assessment. The disability impact assessment was developed in collaboration with the disability community. These assessments are conducted by contracted assessors through Saskabilities. The SED disability impact assessment tool assesses functional abilities, limitations, and supports required to perform daily living activities. It's important to note that there are applicants who are not required to go through the medical form requirement or the disability impact assessment. These applicants include individuals that are eligible for the Canada Pension Plan disability, applicants who have been assessed as requiring a level of 2 care and reside in facilities such as disability programs approved private service homes, mental health approved homes, and special care homes. It also includes applicants who were previously assessed as being eligible for SED. A significant improvement was made to the SED program in February 2023. The online application was extended to individuals and families applying to SED. As many of you know, individuals could apply for CIS online dating back to July of 2019. Individuals can continue to phone or attend a local office to complete an application as well. With the launch of the online application option for SED, individuals that need income support can now apply at any time from their home or with support from a community-based organization as well. The online system also gives new clients access to an online dashboard where they can easily upload their documents or update their personal information, such as updating their address. As the online application was made available to all applicants for income assistance in February of 2023, we do not have the data requested, but we can report that since this change, up to and including February of 2024, approximately 21,000 initial applications have been received. Thank you.
Ms. Conway.
Thank you, Chair. A couple of follow-up questions. Sorry if it wasn't clear. I'm hoping also for the global updated numbers on both Lincoln and I'm not sure if that was provided on my case, but I didn't hear it if it was not just the budgeted amount, but what has been spent total up to date. And then Mr. Exner, I'm sure I did get that dependency rate for 22-23, but if you have it in front of you, could you provide it again because I couldn't find that. And yeah, those are my only follow-up questions.
In response to your question about the dependency rate for 22-23, it's 5.5%.
The total cost of Lincoln since development began in 2008, including the forecasted amounts for the 23-24 year, is $81.9 million.
Regarding your question around my case expenditures, so the ministry has made significant progress in programs and services to ensure that they're simple, client-friendly, transparent, and sustainable. Income assistance, as you know, we launched the Saskatchewan Income Support Program back in 2019 and supported clients to transition from the Saskatchewan Assistance Program and the Transitional Employment Allowance. As part of that, we developed the platform called MyCase, which is the foundational platform or information technology system that would be leveraged and used for future income assistance improvements. So as part of that, last year we did report that to implement the CIS program and transition the support of the Saskatchewan Assistance Program and Transitional Employment Allowance clients, the cost for that was approximately $24 million. Since that time, we have also established the education and training incentive, implemented online applications and self-service features for the Saskatchewan Earned Income for Disability clients, as I had mentioned earlier, and launched the Saskatchewan Employment Incentive. All of those programs, we leveraged what we had already built through the MyCase platform to support the Saskatchewan Income Support Program to ensure that we were utilizing best practices around one common system to serve and support our clients. So with an emphasis on continuous improvement, we continue to work to ensure that clients are able to meet their basic needs. Obviously, we're making many payments through that system. Financial requirements are being met and served. So with that, as those improvements were all added, including the $24 million, so this that would be included in this overarching number, the total spend for MyCase is $45 million.
Thank you. Minister, I just want to put on the record, I went back and checked Hansard from last night. I was very clear about my asks, including the global expenditures for Lincoln in MyCase. I understand finding things sometimes takes time, but we're now at 7:30. I'm a quarter of the way through my time tonight. And I only raise this, of course you have discretion to answer the questions how you see fit, as Madam Chair pointed out last night, but this is a very large budget. It encompasses a lot. I hear a lot from stakeholders. They rely on me to scrutinize this budget. So I'm going to be I'm doing my best to ask concise questions, and I would appreciate it if you could provide as concise answers as possible. And if I don't get through what I'd like to at the end, I'll just put some of it on the record, and you can decide whether or not you want to answer some of those questions at a future point. With that, I'll move on. Last year, I asked about the average utility rates paid through said households, because of course CIS clients are expected to cover their own utilities now out of their meager rates, but said recipients still have their utilities paid directly by the Ministry of Social Services. At that time, average power rates were $126, give or take. Heat was $102, give or take. Water was $127, give or take. It's about $350 and change. I also asked how the ministry whether the ministry expects CIS recipients to pay for their utilities out of their shelter amount or their living amount. And the answer I got was, they can choose, but the thinking is it comes out of their benefit, their shelter benefit. The current shelter benefit for a single person is $630. When you remove those average utilities just based on last year, that's $355. How do you expect people on the CIS program to find a rental location on the private market for this amount of money? And I want you to speak specifically to the case of single individuals on CIS. So I don't want you to introduce scenarios where people are getting the child tax benefit. I want you to speak specifically to single individuals, because we know they're, especially single males, are at a higher risk of suffering from homelessness and have trouble accessing supports. Could you speak to how you expect individuals on the CIS program to survive, given your own ministry numbers around the cost of living and the cost of utilities?
So just in terms of the question for a single individual here in Saskatchewan, and of course the benefit would be slightly different depending where you're located. On the whole of income approach would be for a single in I believe Regina and Saskatoon, yes, $1,128. We talked about the income exemptions that have been part of this budget, but in previous, and I believe that the design of the CIS program, it was to allow some income exemptions before there were any clawbacks. And so that was a change and has been increased this year. In terms of sorry, I should have said this at the beginning, some general comments from me. I'd turn over to Mr. Exner for any added areas he'd like to talk about. But since the CIS program became a program, or online, I guess you'd say, in the middle of 2019, I believe there's been a 26% increase to those rates. And I mentioned there has been in the last 3 years for sure, including this budget, which was a 3% increase. And I think we heard just today, Madam Chair and committee members, that Saskatchewan has the lowest inflation rate here in one of the lowest inflation rates in Canada at 1.5%, I believe. It was previously 1.9, and I think it depends on maybe what jurisdiction within Saskatchewan. So I stand to be corrected on that. I know we have some of the lowest utility rates right across Canada, and there's an independent. Some of the members will know there's an independent institution, I guess you'd say, or a body that looks at this right across the country. It's the MATRE, and there's a MATRE report that comes out every year. And so the province of Saskatchewan fares fairly well in that area. Combine that with one of the most affordable places to live here in Regina, and that's again all those things combined, housing and tax rates and those sorts of things. So that's a general statement. But in terms of keeping up with inflation, there has been some investments because of a strong economy. We were able to help some of our most vulnerable folks out there. Certainly understand that these programs are meant to fill individuals' basic needs. They are income of last resort. That's been sort of the situation for many years under many different governments, and believe somewhat the same sentiment right across the country. I think I pointed out yesterday in terms of the Sask housing, that's an option certainly as well, and that is the great majority of those units are rent geared to income, and again, those rental rates haven't increased in the province in several years. So the ministry and the government certainly recognizes challenges out there, understand that, but looking at the total picture and over time, I think the government has stepped forward with some whether it's new programming or increases to those programs, that has taken place. We have to keep in mind affordability and sustainability in the budgets as we go forward, so these programs are protected over the long term and are able to meet individuals' needs as best we can, as best as individuals can. But I think that was the part I wanted to say. I could turn it over to Mr. Exner if I had missed anything. I probably did. Thank you, Minister.
In addition to the benefit increases that Minister had walked through, there are additional benefits that are available to CIS clients. So there is a $150 stabilization benefit to support people that are hard to house. As we mentioned earlier, there's the education and training incentive. So for those that may be interested in going back for basic education or skills training opportunities, Obviously, we work very closely with our clients to develop case plans and support them to accomplish their goals and help them to set those goals. So part of that is potentially a referral over to immigration and career training. They provide labor market services to help people connect to the labor market, focus in on the client's needs and supports to help them get a job. Along with that, individuals we do have conversations with them, so there are room and board options that they may have at their disposal. If not, they can choose to share. And one of the things about the CIS program compared to some of the previous programs is when you choose to share accommodations, you still receive your complete entire shelter benefit. It is not clawed back or cut in half if you're sharing with one person, or maybe in three if you happen to be sharing with two others. So those are all conversations that occur with clients. So another part of that is during our individualized planning meetings with clients, we do have a budget calculator where we walk through with clients about what their total needs are, what income sources they have available to them, which would include income assistance benefits. It could also be federal incentives or other programs that are available to them. And then looking at their needs. So what are they spending their money on? And trying to work with them to support them to make better choices. As the minister did state, we do have the ability to do direct payments. So that was brought in 2021, and we also have increased our trusteeship spaces. So in all of those conversations, of course, we serve 18,000 different client or households. So those are all very, done on a case-by-case basis, and we look for every opportunity to support those clients to ensure that they are able to have stable housing, which includes referrals over to social housing as well.
Minister, I don't think I heard an update to the average utility amounts paid per month for power, energy, and water for said households. Do you have that number today for the 23-24 year? If it's going to take you more than 3 minutes to find it, can you commit to providing it at a later point?
So what I have available is for 23-24. I just want to, is that the number you were looking for?
Yeah, the updated number.
Okay.
I think that, yeah.
Yep. In 23-24, April to January, we paid on an average cost of about $132 per month for power. This is an increase of $5 from 22-23. In 23-24, we paid an average cost of about $90 per month for energy. This is a decline of $13 from 22-23. In 23-24, we paid an average cost of about $136 for water. This is an increase of $8 from 22-23.
Thank you, Mr. Exner. When the budget was first presented, the numbers that we were briefed on was that CIS recipients would get an extra $30 a month, and that represented $7.4 million in the budget, and that said recipients would each get an extra $55 per month, and that represented a number amount of $6.3 million. I've crunched the numbers based on the beneficiaries that Mr. Exner provided, and it falls well. The numbers allotted, the money allotted for that increase falls well short of what it would cost to give each beneficiary on those programs that increase. Can you speak to that? In the case of the CIS program, if this money was just going to households, that number would hold water. If this is based on households, though, even the said number doesn't add up. So I'm just wondering, it strikes me that those numbers fall short. Can you speak to that? And it was a bit confusing how I asked the question, so if you want me to repeat it, if it wasn't clear, I can.
I'll try to clarify that. So the numbers that you had quoted coming out of budget briefing, it's a 3% increase, and of course that occurs on a case-by-case basis, and that is applied to the adult basic benefit or the shelter benefit. We also, on the SED side, it is the living income benefit. So the numbers that we have as part of our budget are up to $90 per month for CIS clients and up to $55 a month for SED clients. Of course, SED clients do receive actual payments for their utilities, so the actual cost, so that is taken into account. Our budget, the budget is not just simply 3% more. There's a number of factors that go into determining the income assistance budget. So we do our best to forecast and predict how many families we're serving this year, which are generally more expensive than singles, and what that may look like, and the trends around people coming on to income assistance and leaving income assistance. So it's not a straight kind of 3% lift that you would see on the budget. So clients will be receiving a 3% increase on their shelter, ABB. They will also be receiving on CIS the $30 utility benefit if they're living in the north, and then on SED, clients will be receiving a 3% lift on their living income benefit.
Do you have any documentation to show this breakdown? It's very confusing. Are you saying also that SED recipients who have their utilities paid directly, the lift that they're getting may go to their utilities, which are over and above their basic amounts that they get monthly? Like, I just don't understand. Is there any documentation or clarification that you can table at this time? Minister, it was very much framed to the media and in here as $55 or $50 a month additional, and I thought $30 a month additional for CIS. I'm hearing now that that's not clear, or that's not the case. Do you have any projections about what that 3% increase will look like? Anything at all, any meat on the bone, because these numbers just simply aren't adding up in my mind.
Chair. So I'll start off if I think I somewhat understand the question from the member and pass it on to Mr. Exner. So look, I wasn't at your briefing or what you got from it or what you thought or whatever, but again, I think as Mr. Exner had pointed out, right from the social services, what is this? So the draft of the budget, monthly income assistance benefits will rise by 3% for CIS and SED clients. The adult base, and that means the adult basic benefit and shelter benefit will each increase by 3%, representing an increase of up to $60 per household per month. In addition to that, there's a small amount of people, particularly in northern Saskatchewan, that receive the alternate heating benefit. For those households that use alternative heat source such as wood, electricity, or propane, that will increase $30 per month. On the SED side of things, it will increase by 3%, representing an increase of up to $55 per household per month starting in 24. So that was what is the information that was released to the public, I guess, shortly after the budget, and so that was publicly available at some point from social services and of course the Ministry of Finance through the budget process. Mr. Exner, is there, just in terms of the projections and how the global numbers came?
Yeah. As the minister identified, the 3%, again, that is calculated on a case-by-case basis. So with SED, there is a living income benefit. So 3% will be applied to the overarching benefit. All of the rates will be posted on the website. The rate increase is going into effect May 1st, and clients will be notified of their benefit increases in CIS and SED, and it will accommodate the rates that the minister provided, and we do believe that it does balance to the budget numbers that have been projected to support not only the rate increases, but the evolution of the caseload and the demographics of the people that we serve over the course of the coming year.
Thank you. So presumably this 7.4 million for the CIS program and this 6.3 million for the SED program were not taken out of thin air. That's what I'm getting at. What are the projections? How did you arrive at that amount? Can you provide any meat on the bone for me here tonight? How did you get there? Just break it down for me. That's all I'm asking.
Oh my God.
Thank you. I don't have the information with us kind of at that level. So every year, you know, at the start of the fiscal year, we're starting to think about the next fiscal year. We are looking at caseload trends, the number of people that are on income assistance, family size, utilization of the different benefits that are available to those individuals, and what has occurred over the past few years. So it is really based on, you know, the calculation is based on the trends that we're seeing with the projected number of people that we expect to serve over the course of the coming year. That number is refined as we continue to work through the budgetary cycle as we prepare that information. And so with that, the information that we've provided in the news release and all of our budget materials and public announcements, the budget does align with the increases that are being stated.
How do you know if they align if you can't provide a breakdown? I don't understand that. Number of beneficiaries, who you expect to get what. Like, it does sound like these are numbers you've put in your budget speech. I'm just asking you to break them down. There's literally, you can't provide me anything. Is that what you're saying? Minister, just to clarify, these are your numbers, not mine. So can you provide a breakdown of who you expect will get what? How many people on such and such program are expected to get X amount? How you arrived at these numbers, which you put in your budget speech, which you've put in your budget. I'm just asking you to defend these numbers in a basic way.
I'll try to add some additional detail to answer your question. It may not be quite as specific as you're looking for, but it'll give you a general sense around the increases. So in May 2024, said clients will receive a 3% increase to their monthly benefits. So that's over 18,000 households. The living income benefit currently ranges from $961 to $1,789, depending on family size and location of the client. And it will range from $991 to $1,844 after the increase. This benefit increase will apply to approximately 12,500 households. The modified living benefit for a one-adult household will increase from $835 to $865, and for two adult households will increase from $1,340 to $1,385. The benefit increase will apply to approximately 1,300 said households. The personal living benefit will increase from $295 a month to $305. The benefit increase will apply to approximately 4,500 said households. The special income benefit will increase from $405 to $420. The benefit increase will apply to less than 100 said households. On CIS, everyone on CIS will be receiving a 3% increase to their adult basic benefits. The increases to the ABB are from $345 to $355 per month for clients living outside of the Northern Administrative District, and from $410 to $425 per month for clients living in the Northern Administrative District. CIS shelter benefits will increase by 3% as well. The benefit is provided to CIS clients that will pay for shelter costs, which is about 82% of our CIS households. The increased shelter rates per month will be in Regina or Saskatoon for single individuals, $650. The remainder of the province, $590. In Regina or Saskatoon, couples without children, $830. The remainder of the province, $720. In Regina or Saskatoon, families with 1 to 2 children, $1,065. The remainder of the province, $820. In Regina or Saskatoon, families with 3 or more children will be $1,245, and the remainder of the province, $925. As mentioned earlier, the alternative heating benefit is also available to CIS clients to pay for a home heating source other than natural gas, such as wood, electricity, or propane. The rate increase from will increase from $160 to $190 per month, which will benefit more than 700 CIS households, primarily those in northern and rural areas.
Thank you, Minister. That is some of the information I was looking for. Did take about 30 minutes to get there, though. Minister, I have some questions about CLSD. But before I ask those questions, what I hear a lot from people on the CIS and SED program is, how does the ministry arrive at the rates that they arrive at? Can you explain to me in 3 to 5 sentences, how do you arrive at those benefits? How do you get there?
So I think the ministry looks at several things that I'll outline here. Some of the things I've already talked about, as a matter of fact. So you look at things like the Maytree report and where you may rank with other jurisdictions. Maybe other jurisdictions are doing something else. You can look at the general inflation rate within your province, the CPI. That includes those rental costs, utility costs, those sorts of things. The whole of income. Again, it's not just the provincial side of things, but there's other areas where there may be different measures from different areas. So those things are considered, and as a result, again, of a strong economy here in Saskatchewan. Over the last several years, we've been able to increase, as I said before, CIS rates by 26%, ahead of that CPI measure. Since CIS came along, the increase, including this year, has been $237 on top of what was in place for the average person on SAP and T, the older program. On the SED side, 63% increase since that program came online. And again, it was this government that separated out with those with disabilities with those on the other income assistance programs. So, and the CPI has gone up by 40%, so 63% on the increase on the SED side, and then the CPI is 40%. So, and again, I think just in a general sense, that's what the ministry looks at, but then how each ministry's budget fits within the entire overall budget across government. And I think I've said before, it has to be sustainable and going into the future. So have to find that balance with that side of things, but also how it fits in with greater government expenditures. So you have to be careful, and I think, I don't know if you're keeping track, Madam Chair, but I attempted to do that in just one sentence. So I look for you for a ruling on that if required.
Minister, just before you hand it over to your official, that 26% number, would you commit right now to tabling a justification for that 26% number? You claim that the CIS rates have increased by 26%. Can you commit today to providing me a breakdown and some proof for that number at a later time, not tonight?
Read you the information. The CIS program came online in July of 2019, and the average cost per case of the old program was $909, and so 237 on top of that should equal out to 26%.
Sorry, that's for like a single individual? Started out at, sorry, that's the average?
A single. CIS case overall,
Cost,
not broken
like
down by individual or family.
Okay. Is there anything that Mr. Exner wanted to add before I move on? No? Okay. I guess, Minister, sorry, I did have one more question. Do you acknowledge that the CIS program is driving homelessness in Saskatchewan, is contributing to it?
So I think Madam Chair, the question was, does CIS cause homelessness? I would say that's a massive oversimplification of things. I would say no. We understand that there are very complex situation and cases out there. I think some of the major drivers of homelessness is addictions and mental health that can't simply be solved by an income assistance program for sure. If that was the case, I would say the homelessness situation would be exclusive to Saskatchewan. I think anybody who watches any sort of news or has any sort of connection to outside this province knows that is obviously not close to the case. So I've certainly heard from individuals that in talking to folks concerned about the direct deposit, how that may have changed the situation. I know there was challenges prior to the CIS program here in Saskatchewan as well. It wasn't certainly an overnight thing. That homelessness just started right after the CIS program. So direct deposit is available. I've said that I think earlier in the estimates here, but also in this budget we've increased trusteeship. The ministry's increased trusteeship in the last budget as well as this budget. So I could go on and talk about all the programs. I've already spent time on those things. The employment incentive. There are many homeless initiatives that we worked on, the provincial approach to homelessness, and we've talked about the shelter system and trying to get individuals back on a good path. So we continue to work with CBO partners on these many challenges. Again, not unique to Saskatchewan. So to say it's just one program, and if we just change that, things would change overnight. I think that is wildly speculative and quite simplistic to that. Acknowledging certainly there's more to do. I'm always listening. I think the ministry is always listening, and that has resulted in some of the investments we've been able to do in this budget. ID, for example, we talked about that. So we can always do better. We'll continue to work with our partners, but that statement that the member brought forward, I think is quite overly simplistic with the challenges that we're facing.
Thanks, Minister. So I didn't say one program causes it or that taking away CIS would change homelessness overnight. I didn't even say that CIS causes homelessness. I said contributes. No, like referring to the words I used, that CIS contributes to homelessness. Would that change your answer?
No, I don't think so. I think it's a complex situation and a situation of homelessness, not unique to Saskatchewan, but we're trying every day to help individuals get the help they need through a variety of supports out there. So again, one program in one province. I don't think is the total answer. I would say the income assistance that we're able to provide in Saskatchewan certainly helps the situation. Obviously, if there was no such programs anywhere, if there was no investments that we've been able to make because of a strong economy, I would say things would be much, much worse if we didn't have CBOs willing to take on some of these challenges. So, I think I'd like to correct myself. I think I said direct deposit. I meant direct pay, and so I apologize for that. I got the two mixed up. So I think I'm done with my answer.
Thanks, Minister. I'm going to move to the CLSD area. We have 25 minutes left, and one of the things that as critic in this area, I've been hearing actually has had a massive increase in people reaching out to our office around this area. So I think what I'm going to do is list some questions into the record, and I'm wondering if you would commit, after hearing these questions, to either telling me that you don't track that particular information, or commit to providing these numbers tonight or at a later point. Is that agreeable?
We'll see what the questions are, and if we can answer them, yeah.
Estimated number of individuals with intellectual and developmental disabilities in Saskatchewan. 2, the number of individuals with IDD, just abbreviation there, supported in group homes in Saskatchewan. The average wait times for group home placements. The number of individuals on the CLSD group home wait list. The number of group homes with vacancies, and the number of individuals that are supported through the self-directed funding model. These are a little bit more specific. I'm wondering if you track the rates of ER visits for individuals with IDD supported by group homes in Saskatchewan. I'm wondering if you track the rates of hospitalizations for individuals with IDD supported by group homes in Saskatchewan. I'm wondering if you track the rates of 30-day repeat hospitalizations for individuals with IDD supported by group homes in Saskatchewan. I'm wondering if you track the rates of alternative ALC designation for individuals with IDD supported by group homes in Saskatchewan. We can start there, or I can keep going. I have about 8 other items that I've been asked to ask about. Staff turnover rates for group homes in Saskatchewan, do you track that? Mortality rates of individuals with IDD after transitioning to group homes? Medication errors in group homes in Saskatchewan, do you track that? Protocols around medication errors, do you track that? Protocols for handling accusations of abuse or neglect, standard requirements and health policies for group homes in Saskatchewan, health data comparing group homes that have nurses involved and those that don't. Do you compare that at all? And finally, do you track discharges from agencies and the rationale for those discharges? Minister, ideally what I'd get on this is either like a commitment to provide this at a later time, or just an indication that you don't track it if you don't track it.
Joel Kilbride, Assistant Deputy Minister of Disability Programs. I don't think I caught everything that you asked for. There's quite a few there, but just a few things that we do have. You asked about the number of people in group homes. Currently, we have 1,318 people in group homes. Group homes with nursing staff. We have 6 group homes that have nursing staff, and then 2 additional group homes with mental health nurses, and then 1 day program. And then the number of people on self-directed funding is 50. Other things that we do track but we don't have with us here today are mortality rates, medication errors, and hospitalizations. And then there are several other things that you asked for that we actually just don't track or we didn't capture. So some of the things that you asked for that we wrote down that we know that we don't track include rates of ER visits, 30-day repeat hospitalization stays, ALC patients, and discharges from agencies, as well as staff turnover in community-based organizations.
You mentioned the facilities with nurses. Do you have any comparative data between outcomes for homes that have nursing staff and those that don't? If you're going to go away again, can you provide the number on the wait list, and then can you just commit, because we have 9 minutes left, any outstanding items that you didn't catch, can you commit, Minister, to following up with me and just saying if those items aren't tracked, and if you do have that data, to provide it at a later point?
Just, I don't think folks are not completely sure we got the entire list. You ran those off pretty quickly. So the ones that Mr. Kilbride talked about and your number that you want, could you repeat the ones that weren't addressed by Mr. Kilbride?
I'm just saying, like, it'll be on Hansard, so we can do that at a later point because we have 9 minutes left if you're okay with it. I don't know if you have the number on the wait list, though. That would be nice to just hear if you have it.
We'll see if we got it.
I just wanted to give you a bit of context about our services. So Disability Programs has 290 group homes currently, and across the system, outside of even our group home services, we are serving over 6,300 clients. We've added 174 group homes for CLSD since 2007. And so what the ministry does is we plan for services to meet the needs of our clients, and we work to serve those clients with the most urgent needs with the resources that we have available. And so we're always evaluating the needs of our clients to identify who's the highest priority for service and who might be at risk without a service. So all of our clients have some level of support, and we ensure that our clients are safely supported. So some individuals might be looking for a group home placement, and if that's not available, say in the community of their choice, we might provide something else for them in terms of service. So that could be a day program, respite services. We also offer flexible funding and self-directed funding. So there's other options while people are waiting for service. And so we actively prioritize the needs of individuals to ensure that those that are most need in service receive it first. And first consideration when prioritizing service is really the urgency of need, but other factors have to be considered as well, such as availability and appropriateness of existing services, suitability with others in the home, services under development, environmental fit, level of risk, valued outcomes for the individual, and geographical location, and of course, level of support needed. So again, our clients are supported, and will continue to work with individuals and their families to develop services as needed based on the greatest priority.
I didn't hear a number for that wait list, or as I believe the CLSD calls it, the emerging wait list. But for a lot of these folks, these aren't emerging needs. These are needs they have today, families and individuals languishing today. How many people have gone through a CLSD application, have been referred to an agency, and are on a wait list?
Yeah, so we actually don't have a number for you. The ministry doesn't track in that way centrally. a number of people do apply to community-based organizations, sort of several group homes or day programs, and they get on lists, and so they might be on various lists at the same time waiting for service, but the ministry isn't tracking that centrally.
Can you provide it? I'll let you finish. Can you provide anything you do track in this area? If it doesn't track in that way, is there something you do track, and can you undertake to provide it?
We have agreed upon time. Do you wish to answer, Minister? Okay.
I think since the time situation, I think it was suggested the ministry look back at Hansard to see what is available and what can be provided, and we'll go from there as to what information CLSD has based on the various and multiple questions from the committee. So.
Thank you, Minister. Having reached our agreed upon time for consideration of social services, we will adjourn consideration of these estimates. Minister, do you have any closing comments?
Well, again, I echo what I said last night, I believe it was. Thank you so much for the officials, the hard work they're doing to prepare for this, but prepare every day. They do a lot of work, and work with complex and multiple people across our province, and try and make things a little bit better. I think this budget supported that work by our wonderful public service, and we thank them. I thank them and the CBOs we work with closely each and every day, and thanks to the committee for your questions and attention. Thank you.
Ms. Conway, do you have any closing comments?
Yes, Chair, just by way of closing comment, this is a $1.5 billion budget. It's an important budget. There's a lot at stake. I feel like some of the considerable delays around answers hampered my ability to scrutinize it as much as I would have liked to. But of course, this doesn't take away from the hard work that officials did in preparing for estimates. I will be following up with the Minister by way of letter to cover off some of the areas that I wasn't able to touch on. And there's just 6 I'd like to put into the record with your allowance. That's questions around concerns around the Accessibility Advisory Committee, CBO sector, a human resources strategy to bring caring professionals onto a level playing field, child care subsidy, multi-year funding, lease issues with SHC properties used by CLSD, as well as what I've heard, this is something I will follow up with the Minister on, a rumor that group homes are no longer going to have that 4-person cap, but may now expand to 5 to 7 people. I had questions about these areas as well as many others, but these are perhaps some of the more important. And I'll be following up with the Minister by way of letter. I do hope that he will provide as fulsome answers as possible on these items, given that this is a large chunk of money and what is at stake for the people of Saskatchewan here. Thank you.
I too would like to thank the Minister and all the officials for all your hard work, the Legislative Assembly, staff who are here with us this evening, and the committee members who are here tonight. Thank you and have a good evening. Moved. All agreed? This committee stands adjourned until Tuesday, April 23rd, 2024 at 3:30 p.m.